Karamoja is one of the poorest regions in Uganda, with an approximated population of 1.2 million people. In 2019, the Ministry of Health declared it as one of the most TB-burdened regions in the country, with 5 out of 10 patients completing treatment, 3 cured, and 2 succumbing to the disease. The following year, the area notified 1,075 new TB cases, affirming the alarm that the fight against this killer disease is far from over.
TB is one of the most important diseases in the sense that it causes a lot of death and illness in the Ugandan population. And every year we expect to have about 82,000 new TB cases in the country.
And it is pertinent that we remind the people of Uganda that TB is still a big burden in Uganda. And Uganda is one of the 30 countries that is still grappling with this high burden of TB.
The highest crude prevalence of tuberculosis was reported in the Karamoja region at 2,394 out of a 100,000 population, almost 10 times the national average.
Ever since TB has been in Karamoja, we have had also MDR cases. Cumulatively, about 150 cases have been notified since the beginning of the programmatic management of drug-resistant TB in 2015.
The region's treatment success rate sat at a low 48% in Uganda, and this was linked to the migratory nature of the pastoral communities, low income, and lack of education. This necessitated the intervention of several health organizations like CUAMM to support TB patients' complete treatment and see this rate improve.
Since 2018, Doctors with Africa CUAMM is implementing a TB program with funding support from the Italian Agency for Cooperation and Development and Fondazione Assistance Internationale, covering the 5 southern districts of Karamoja region. The project aims at supporting the districts, their facilities and the communities in improving the quality of the TB service delivery, both for drug-susceptible and drug-resistant tuberculosis.
Karamoja, Maken, Maria, Abunta a lot of the sub-count to pay, Paris, Lokuma. A guy I ram a rebo. I can't think why I rebo. Togaking I agree, Makan, I create Nedadang, Taka, I come in Nedadang. So I will keep you running. A guy on you, Pakaladakatare, Roinis, Layapi. A guy a lot of name. Kaya rarukum paka Roinis name. Awala kaya rarukum, Mara Yarukum na Paka Kampala. A Yakazing no moon yet Arukumalu, a Roinis. Abuna Ani kept Bunga at the Kamaga, a result Kamaga in Yaboka. You. Upon it, not when I be TB.
After Maria's 2 months treatment, she was discharged out of hospital and directed to take her medicine from home. But after 3 days, the doctors drove to her house and picked her up.
A boy Maria Jolagino, Akonirukum. Jolagina Konirukum, Mangerenyo, Nikitolugu. Angerang tolu ni Likelugu. I toner a Parakonirukumai, Kidiama.
Maria's TB level had escalated to a multi-drug resistant stage that, if not attended to with haste, could be fatal.
Amazing is Dani Nirkakin. Naginiang Kado Katabakayong, Lore. Apani aya Nyona Lore. E mama kilele la boko la buni aya nyuna yokoi. alo daktari nyebune kile paka jik tarawni aitia kayo ke kile ngol gwe kile ngol tema be are zilimu kone riamune tabero naga.
Left to fend for her and the kids, Maria received some transport refund from CUAMM and more assistance from other partner organizations that would continue assisting her under treatment.
Ngale ubo ko na kwa kana kina yong nka boro lugwa kana na ke moj ngoro lugwa uto hamaret azu kwari ngoro ngo mono lugu ke transport ngedelenga kone ko gelang na ya azim patenga azim naga ko tara to pipe nyoni akowan ani la tala ramune reke si azim kori itingi yade ko zinamba ni radio ni riacha kina na koan taramuni azimu ai magane ni kes bae boy je gangat eli kayong kita lu kange zendani na amazicha ni arenga oporo epe zabit ba oporo epe zabit tama ai aka opore kayong kana emazi ya ketoy kamazi zendani emazi ya ketoy kamazi zendani aka opayang.
Once again, Maria abandoned treatment for a week.
Taramune tenge da kata ku gazi ke bwana zanaga tarama azim ngeda kata ilu tarama da maga bo ko rika mam nyebuna Maria ngata ka za bit nyebuna mam nyebuna je to koy ana ngagi ne karama gine tana bagugi Maria nyubo mam guniti yo ngata ma ka opure ka yang je ke mata kita bian ezi chok na be peza tama bian roba gwa angololo talelew ayo na ngin ta dawna yo ni etoruni zicho kangena to dawle te kugi kama ama to ka pa lore nege ko munete renga ka kala yela pa ngol pa yawi ako munete Maria to nyug ai apegite ai ima mi kero na boko ala ka pa burndira ngara bunere e boko ya mam nyago uteriyo ngato nyuga fa na lo to be chade tu ataga kin te kwangin tamarete to nyawre yong hanyawni to nyawni ka ko ngida ngare lugu ni ada kit ka ngini che atamari apana wagi ni boro la ke ka puru ko daji ko ngina feje ka lol robo kana ba ngakrona du boy kini malo tana ya maga ka panisi nganga bito ngine ngare boy kini maje buya ko kai buya ta ka ta ya tama ba ke jigra kan mo bijik hawa harau na itu caya na ya beneran nai maka magai boy kini ngala bito ngare lugani abomuni na ya tamari apan nai lore betolo to lore bu na itu cala fe ana ite na ka to ka ke mo ka zelenga lugu mboro lu dadang he mare to lu ka uto obuni aya lo felakal ya buni na tamakina na ite tama ka mo ina baka ya ke to ka fe do na ba lo se ki boy maga aki boy kama wezi kinta yong kade boko nan kade lu chiklugu nai kwana e kile dalo ye na mani e mamu na boyche mamu na boyche to ngani e pedo rak daran kade e lili ngara kilili ana yangi rikino na yake tay logo tarawina ya wona ke tay paka la da ke tari logo tawro de lo de na ka abesiti na kera na zena kera naga Elozi, ako ame kita nini, akain ayam. Ya wana ni keng, na ya lozi na ye eli ko na ni keng. Eli kina ya na kita ni keng. Ni ka be si, aka na tengena na sena kere. Eli ki jiga kita ni jig. Aja ko na pe. Aja tene rongo na jikara kara na rupia majik.
We are glad to say that the strategies introduced have been able to improve generally the quality of care offered to the TB clients, including a strong follow-up of the patients in their communities. And the main results of these strategies is an improved retention in care that is then later translated in better treatment outcomes. In fact, in the last 2 years, we have seen the loss to follow-up rate reducing from 42% to 8%, and the treatment success rate instead increased from 36 to 85%.
And because of the CUAMM intervention, we managed to put the first gene expert, the machine that detects that organism which is resistant, okay, to the key medications. We got the first gene expert and put it in MATANY hospital. And from there on, we continued to build on following up the patients who were picked up wherever they came from, using a model of care which we have now coined as ambulatory care model. Okay, so we were following these patients and treating them close to home, okay, through their nearby health facilities, Health Center 2, Health Center 3. Of course, we had to do the needful to train the staff and give them the capacity, those health center staff, to give them the capacity to be able to put these people into proper treatment and to follow them if they got lost.
Another TB survivor who has benefited from this good job is Okalapo.
I came to understand the virus when I was working in Masindi. I worked there for almost 9 years. So the 10th year, that thing now started coming to me. I didn't know that it is maybe TB or which illness, whereby I tried to go to the early centers to take the sputum to check whether what illness is this, but actually I failed. Then reaching the 2019, I had to say myself, since I failed to identify what's happening, it's better let me go home. I find elsewhere what is happening. The 31st, I reported to MATANY hospital, whereby I was sent for X-ray, saying that wait for results. When the result came late evening, they said that admitted to TB ward. When I was admitted for 2 weeks, I received treatment. After receiving treatment, then they said you can now go home and start getting treatment from your nearest early center.
Paul started taking medicine from home, but his journey to healing was averted by the global coronavirus pandemic that exposed him to social segregation and stigma.
When COVID-19 came in, things become disorganized. Now people came to think that, since the virus has come which is finishing people, this might be the virus which these people they are having. Even where I was staying, they had to talk to the landlord and say that, why are you keeping this kind of people in this area? Or you want all people to die? They had to go to write letters to police to go and report to the OC. The OC came to me and said, please go and get your clear clarification from your doctor.
Paul was pushed to defend his health status as fear of him spreading the coronavirus in the community was escalating. He turned to CUAMM for assistance.
I went in the morning up to MATANY hospital. I got my staff plus the doctor of CUAMM group. I told them what is going on and what is happening, and they wrote for me a letter. After writing a letter, I brought back to police. They brought a report back to the people. And the people were not understanding it. They couldn't pick it. Even though you go to the market, you say, please give me, maybe I want tomatoes for 1,000. They had to say, these things are not for sale. They are not selling it. Because they know that this person is what? they suspected it has a coronavirus. Even though you go to the shop, they said, things are not for sale. I say, no, what is happening? If these people have started eating me like this, even though you come and sit with people like this, people started running. I say, no, things are worsening. Unless I was renting a certain house in the center, whereby they told the landlord, we are giving you days to remove this man from the house. Let him go back where the parent is.
Even with a medical clearing later, the community still dejected Paul and drove him towards suicidal thoughts.
Now when I think myself, I say, if the community has rejected me like this, now there's nothing again which you can do in this world. It is better you go and what? And just enter the river. Then when I called the CUAMM group, they told me, be patient. They are going to come and we talk to the community and we tell to the community what is happening. The CUAMM group doctors plus the staff doctors, they came all together and they talked to the community and they tell them, this guy is not a coronavirus patient. He was detected as a TB patient, whereby we kept him for 1 month in the hospital, releasing him out, knowing that that germ which was spreading to others has what? Has died. If he goes home, he will no longer spread to what? To others.
Through such challenges, CUAMM and supporting organizations continue in the fight against TB by continuing to avail assistance to the people of Karamoja.
Yeah, we call upon the government through the different partners to put in place accelerated interventions in the communities, help identify, detect, and bring back patients or clients who have TB.
And I want to end by thanking the Ministry of Health that supported us in all ways possible, the districts that worked amicably with us, the district local governments and the district health teams. And I want to thank also the other collaborating partners in the region. We have other implementing partners that are supporting TB, including IDI, including TASO, including RIGHTS-E, and their complementary effort also contributed to the progress that we are realized. And I want to thank, of course, the management and staff of CUAMM that have been working on this, including the support we have been getting from our headquarters in Italy.
The government of Uganda is very concerned about the health of its population, and government has made TB services available in all public health facilities and accredited private health facilities. Treatment is free of charge. Remember, when you are in doubt, you will spend a lot of money in the private health facilities looking for health or seeking for diagnosis. I want to encourage you to report to the public health facilities where treatment for TB is given, and you will be screened and treated correctly. Do not spend money when treatment for TB is free of charge.
Tuberculosis is a killer disease that can be eradicated through encouraging and assisting patients to start and complete their treatment.